Hello, my name is Amy Sutton, CEO of Crossroads for Hope, a network of cancer support. We appreciate the opportunity to apply for the SAX 2024 Founders Award and to share with you how we are empowering people affected by cancer and the communities in which they live. Crossroads for Hope is what comes next when a cancer turns a person's life upside down. We focus on people, not disease. We are on a mission to take on the cancer journey with all those who are impacted because from diagnosis on, individuals are not prepared to face the fear, worry, and isolation that follows, or the barriers and gaps in care that they will experience. Most people also do not have access to the one place that can provide a trusted network of support, information, resources, and people who understand, all essential for navigating the cancer journey and for people's ability to take control of their health and care. Our program is rooted in an evidence-based empowerment model called the patient active concept, which is essential because everyone impacted by cancer experiences distress, but more than half of people experience distress at levels that affect their ability to function each day. Our social work and child life teams address the emotional, social, and practical needs that cause this distress by providing individual support, education, navigation, or referral resources, treatment decision support, and financial assistance, all of which helps put people in the right frame of mind to be able to take in information and act on those resources while gaining new skills to help them improve their understanding and ability to self-advocate. Our wraparound programs, including support, education, nutrition workshops, and mind body classes, help increase social ties, help people embrace healthy lifestyles, and add hope and meaning to individuals' lives. We're also not waiting for people to find us. We have prioritized outreach into marginalized communities, starting with a pilot in New Jersey, because people are dying from treatable cancers due to the barriers and gaps in care they are experiencing, such as a lack of transportation, health insurance, childcare, as well as food, financial, and housing insecurities, all of which prevent access to timely cancer screenings and care and prevent people from being able to stay in care when needed. This disparity is ripping at the fabrics of people's lives, their families, and communities. Crossroads for Hope is utilizing a global model of community public health as our approach to empowering communities. We are developing partnerships with trusted organizations as points of entry to our work. These partners include those that conduct cancer screenings, libraries, churches, social service organizations, and schools. Through these partnerships, we deliver educational workshops that help us transfer knowledge about cancer, nutrition, and ways in which people can enhance their physical and mental well-being. We've also developed a health champion program as a force multiplier for change. We are training community members as first responders to cancer and its emotional and social impact in ways that help normalize conversations around the disease in communities that are afraid to talk about it. We teach people an evidence-based approach to making treatment decisions, including how to access information about clinical trials, which is so essential. Most importantly, we're giving people the tools that will last them far beyond their cancer experience, the ability to self-advocate for one's health and care. An example of this is Angeline, who recently attended a health champion training workshop that we held at the Elizabeth Public Library. She said she came to us because a colleague was misdiagnosed with diabetes and ultimately died of pancreatic cancer. She had repeatedly attempted to tell her doctor something was wrong, and the doctor told her he didn't have time for her questions. Angeline told us that I never want to be put in that position again where I can't help somebody I care about. She is now referring people to us from her community. Another example of the impact of this work is a longtime member and cancer survivor, Julie. Recently attended a different health champion session that we had run in the community, and now is regularly able to refer people to us. And she starts by telling people, I'm a health champion. And that breaks down any barriers to communication about how she can help. We want to be able to scale the Health Champion program to reach 500,000 people in New Jersey, which is about the number of people in the state currently living with a history of cancer. To do that, we need to train 2,000 champions who are on the front lines helping to respond and connect people facing cancer to support and resources that are fundamental to a person's cancer journey. There are a lot of organizations in the cancer space, both in New Jersey and nationally, but none provide the direct service delivery and activation the way that Crossroads for Hope does, which is why we want to mobilize an army of health champions, because patients and families can't wait, and no one should ever face cancer alone. Thank you.